Hi, I'm Dr. Tony Rector. I welcome you in your exploration of possibly working with us at Southlake Integrative Wellness Center. As we start our time together, I want to tell you a little bit about myself and a little bit about who we are. I've been practicing over 30 years, and over that time I keep seeking reasons why people become sick. And that really led to the passion of starting who we are 10 years ago. In that 10 years, we've grown a significant amount, and I have a great team of people, that both front office, back office, and other providers, that we want to be in partnership with you on your healing journey. We provide primary care. My experience is over that scope of time, so we can take care of scraped knees to sore throats and those in between. We don't do any after-hour care that require you to go to an acute care clinic or something inconsistent with that. And at this time, we don't take insurance, which allows me the freedom to make independent decisions in your best interest for your medical care without outside influence. One of the principles I want to stress is the entirety of the holistic, how the body works together. And common complaints that people come to us with is fatigue, gut problems, immune problems, allergies. It goes to a whole mantra, and often there's an underpinning of things that are imbalances. And what we see often is hormonal imbalances, digestive disturbances, possibly even lifestyle imbalances we stress, and even influences from outside infections or even environmental chemicals. All these help us determine why, because we're a practice that tries to get at the root cause, not just give you a substance to just control the symptoms of it. And that's a key principle we're always emphasizing about our practice and about our service. And that's what drives us. That's our passion, to help you do that, because ultimately we want you to be well. We want you to have a whole great life, or I've often said to my patients, I want to work myself out of a job. So I hope that's your passion. We want to join you in that partnership. That's a mutual commitment. My part, to be a person who is always being a provider who is looking at the best current research to apply, and your part to put some of that to use in the way you live your life. So I'm excited about the possibilities with you. So once you make an appointment with our front staff, they'll direct you to establish a patient portal. Including that is a form that's very important. Is your initial patient history form. It's multiple pages long. It is not busy work. I go over every single page of that before I even see you, and it tells a story. And it actually helps me start directing a guided history on your initial visit, which is easily an hour long. And it really cannot be stressed enough, because so much of why people have problems is really told in the story of their health. And there's a chronology of why things happen that create breakdown in health. And you're going to find that on your first visit. And some patients actually find it helpful to actually create almost like a health diary before they come in, a chronology history of what's happened to them along their life. Could have been a stressor, could have been an injury, could have been an accident, could have been various different things, but those all have the potential playing into your health. And we spend a lot of time on your first visit discussing that form and in detail going deeper in the history. So once we receive those forms and I've reviewed that, then you come in for your initial evaluation, which again is about an hour plus long. I think first thing you're going to notice in our office is a really warm, welcoming environment, both in our people and our atmosphere. We want to exude a sense of just calmness and, if you will, a healing climate or environment for you. One of your first experiences once you're greeted at the front desk is a microscopy. This is a simple test that allows me an overview of what may or may not be going to health imbalances. It's a simple finger prick where a drop of blood is looked under a microscope. Then into the room, we review your history even more detail, and then that moves us into the physical exam part where we do a head-to-toe examination. I would add, as a side note, one of my past experiences professionally is actually teaching physical exam courses in the medical school setting. So it's kind of one of my special emphasis that I fear that's been kind of left out some in the hurriedness of medicine these days. Once we do that, then we come up with what tests need to be done. And any test you've had done before in the previous time, it's always helpful to send that forward to us. We'll go over that as well. We'll establish the needed tests we want to do. It could be blood tests. We have a variety of specialty tests, which may include from anywhere from food reactions to a variety of other tests. And then we ask you to start getting those tests done. We'll also do some basic therapies, particularly lifestyle, which revolves around sleep, exercise, nutrition, and maybe some things of stress balancing management. We use supplementation. We use other methods as well, but I may or may not use medication on the first visit. Typically not, but not necessarily every time. You will get a comprehensive patient instruction sheet. after your first visit. So you don't have to remember, what do I need to do? It'll all be given to you. And you have that document as kind of a guide or a roadmap before your next visit. Then our next visit is happens about roughly 3 to 4 weeks after the first, and we call that established wellness visit. After that time, we've put in some treatments into action, and we now have a collection of data. This is probably equally important as the first visit, because now I have a fuller picture, or often an analogy I like to use is puzzle pieces. So many problems people have are different puzzle pieces, and I have to be able to see the puzzle pieces, lay them out to try to figure out what's going on, and then direct the course. When we have those puzzle pieces laid out, then we get more intentional about our therapies. And again, it may be more of the same, or if you will, more focused on our therapies. We even use IV therapies, and we're happy to discuss with the practice, but not every patient needs that. Once we put those treatments into effect, then it takes time. I often tell my patients, you didn't get here overnight, and it takes time to proceed on the healing journey. And that typically is measured in weeks to months and not in days, so it does require diligence and patience. So often our third visit, which is what we call the treatment response and adjustment visit, is typically about 3 months after your second visit. You may or may not see me on that visit. Once we establish your care and identify your primary health challenges, I may be the one to see you, or you may be able to see one of our practitioners, which would be a nurse provider, or a nurse practitioner or physician's assistant. Think of this always of a journey of health for you. Included in that, we're going to include video education. We're going to give you some diet guidelines, some activity guidelines, and again, supplement and stress management guidelines as well. You always have access to your patient portal, which gives you that information, as well as a way to dialogue with our staff through the portal for messaging back and forth to see each other. So I hope this video is a way to say, what am I expecting in these first several visits as I walk down this next chapter of my journey of healing? I thank you for your interest in Southlake Integrative Wellness Center and looking forward to working with you.